We are coming in hot. Go.
You don't have to live in pain anymore. This is the podcast where you'll learn the stories, tips, and tools to get back to your path to health. I'm Dr. Dudum. This is Back at It with Dr. Decompression.
Welcome. This is the Back at It with Dr. Decompression. I'm Dr. Dudum. Episode 47. We're inching closer to 48, 49, and we're going to hit 50. Hey, before we get started in episode 47, I want to thank our sponsors, PowerPlate and PillowWise USA. Thank you for supporting the podcast. Let's jump in. I'm very passionate about this topic. Get this question, one of the most common questions I get. And I want to give a shout out to Go Fish on YouTube. Go Fish 163 commented on one of our posts. I ask you to comment. So please comment on this episode or any of our videos and subscribe. I'm going to answer your questions on the air, which I'm doing now. So GoFish163 said, hey, it made my back worse. I don't know who this person is. I've done over 25,000. We're almost approaching 30,000 spinal decompression treatments. I've done a few. And not one patient has left worse than they started. Now, I believe I can help everyone. What we want to make sure is that it's safe. And then what we want to make sure is that how are we going to do it where it's not going to make them worse? So no one's gotten worse from my program. Now, there is 5 to 10% of patients that don't get better. Not everyone gets better, but 90% is really good. So today I'm going to talk about the three main reasons in over 25,000 treatments that a patient would not get better with spinal decompression. And if you didn't know it, you could make it worse. It's possible. Let's talk about how to avoid that. Here we go. The three things that could make it worse. Number one, I'll share my own personal story. When I got my first decompression table 5 years ago, again, I had an L5-S1 disc herniation. It was on the nerve. It was a biting the nerve. My leg was on fire. My butt was in a spasm. I've talked about it before. I know that's a disc injury because I had it. My butt was on fire. My piriformis, stop stretching your piriformis if it's spasming. And my leg killed me. We just got the decompression table. I trained with Jocelyn. She's our director in our decompression center now. And we went for it. We pulled myself with 70 pounds, kind of the max that we should have pulled. And oh my gosh, I got off that table for the first time. I could barely walk. It was so intense. The pull was so intense. It took 2 or 3 days to feel somewhat normal again. I actually felt better after 2 or 3 days, but that was intense. And quite honestly, I could have said that a day or two it made my back worse. I could say that. I was kind of nervous to get back on the table. Honestly, I was. And I had to because I didn't want to have surgery. So I developed a game plan and a strategy to go really light. So if I did 70 pounds, if I start patients, it's usually 15, 20, like it's so less. And we slowly build up their tolerance because what happens, so for the listeners, I'm sorry, but I'll describe this to the viewers. As we decompress, if I just go like this, it's creating a larger micro trauma. Think of it as working out. If you're working out your biceps, if you do heavier weight, you're going to create more of a micro tear in the muscle, and it's going to grow back stronger. It's a good thing, but it could be painful. Same thing happens here. When I decompress, it's creating a small micro trauma in the supporting tissue. But if I go harder, it's going to create a larger micro trauma. If it's too much too fast and your body's not ready for it, you could walk away feeling worse. That can happen. The only patient that's happened to is myself 5 years ago. And then I got back in the decompression table, adjusted my formula, and completely fixed my back. But I work with colleagues and I consult with other clinics that do decompression. And one clinic I spoke with last week, we were discussing angles and weights and pull and oscillation cycles, anything you could think of. And their starting weight was way too high, way too high. And they were wondering why after 8 to 10 sessions, this patient had continued to feel not better, but agitated. Their back felt kind of worse because the weight was too high. So it's absolutely possible. How you combat that is you start slower. We start very slow and very conservative. That is one of the ways that we get the success, but it's also one of the ways to be mindful of or aware of that could make you worse with spinal decompression. So it is possible. Starting with the correct weight is vital. It's vital. That's number one. Number two, I want to know everything that's going on in your spine, and I want to know every millimeter of the disc material. How do I know that? I know that by getting an MRI before I treat you on the table. Before you get treatment, you must have an MRI. Why? Don't you know it's a disc herniation? Yeah, I do. But I want to treat it effectively and safely. In my experience, in my 25,000 treatments, again, sorry for the listeners, but for the viewers, I'll describe it for the listeners. If you have a posterior lateral disc herniation, like this one that's on the side, I am going to angle you and treat you on the table completely different than if you have a central disc herniation, where the herniation is actually more in the middle, affecting both nerves. I would treat you completely different. My angle would be different. The rate at which I accelerate the speed or the increase in weight would be different. The at-home exercises I give you would be different. Another analogy, if you have a disc, hey, I've got a disc extrusion. Now remember, you've got the disc. If this is the disc, okay, here's a jelly-filled donut. This is the donut. The inside is the jelly. That is the disc that's in between the two bones. You've got bone, disc, bone, disc, bone. And that's the jelly-filled donut. So if you have a disc extrusion that's cranial, up towards the cranium, I am going to angle my table 12.5 degrees to create flexion, to get that to come back in. Okay. On the opposite side, if it's not towards your head or cranial, if it's caudal, now caudal means tail towards the bottom. If it's gone caudally, I have to either go face down the table or I have to angle you below to create a spot for the disc to reabsorb. How do I know this? Because I've seen so many hundreds and thousands of patients with disc extrusions, and I've gotten them to reabsorb. Yes, they do reabsorb, shown on a pre and post MRI, but the angle is so critical. That's why I have to know not just if it's a herniation or a bulge or an extrusion, but if it's an extrusion, is it up towards the cranium or down towards the caudal or tail? And back to the thesis or the concept of this episode, if you have an extruded disc that's gone up cranial at L4, L5, and I do not flex you, I do not go like this, and I kind of almost treat the L4, L5 directly, it could make it worse. It could make it worse. So you have to know this going into it. That could make it worse. Having an MRI would eliminate any doubt. That's number 2. Number 3, one of the reasons the thoroughness we do is with x-rays, not just a standard x-ray. We take flexion extension films. I know. What does that mean? It means that you stand straight, we take an x-ray sideways, and then you lean forward, we take an x-ray, and then you lean backwards and we take an x-ray. It allows us to check how your spine moves in the dimensions, in the motion. So here is to be a straight shot. You lean forward, picture. You lean backwards, picture. Now, it's different than a fluoroscopy that you're thinking, oh, well, you see the whole range of motion. That's not what we see. What we see is, hey, when you go forward, does it slide? That would be instability. And if you lean backwards, does it lean back? Does it close off the canal? That is going to tell me a lot of things. One of the biggest reasons you can get injured with spinal decompression is if you have joint instability that is unnoticed or undiagnosed, and you pull with a lot of weight at the level of instability, you most likely will get a flare-up. So if you get a flare-up, getting pulled really hard, it could be that it was a large microtrauma, or it could be you have joint instability and the bone slid a little bit. When I say a little bit, guys, I mean a millimeter or 2, but that's a lot. And that could be why. So if any patient has an anterior lethesis where the bone has slipped forwards, like such, or retro where it's backwards, immediately we take flexion extension films to rule in or out joint instability, which is a huge obstacle with decompression. We can still help you. It just determines and alters the angle and the force we're going to pull you with. That's the key. It's not a no-no. It's not a contraindication. It's just, hey, we have to know this is going on, because if we pull too hard too fast, or if we pull at the wrong angle, it could flare you up. That's why we have to know. I'm thinking of a case, Randy. Randy came in, for lack of a better term, his spine was pretty messed up. What I mean is he had multiple levels of severe degenerative disc disease. He had multiple disc herniations, multiple levels of spinal stenosis. There was a lot going on. We were targeting a specific area based on the testing that we did. And Randy, some things got better, some things it was kind of odd. He didn't respond in a normal fashion. But see, he didn't have any structural abnormalities as far as an anterior lethesis or a retro. There was nothing like that on his previous imaging. But because after 2 weeks he wasn't responding in a normal way, we took flexion extension films. When we took the films, we noticed that when he slides into flexion like this, his L4 on his L5 slid, which means the ligaments and the soft tissue that are supposed to stabilize and secure him through normal ranges of motion, they're a little bit tired and they're laxed and they don't work as well. So he has abnormal motion of his spine. That doesn't mean we can't help him. No, we can help him. We have to change the angle based on the instability. But if I was a stubborn, inexperienced practitioner, my method might be to just continue to pull harder and harder. And I'm 99.9% sure that's going to make him worse. That would have made him worse. So what happened with Randy? Randy, we changed to flat. We changed to flat to eliminate any type of slippage forwards or backwards on the table. We're eliminating the variable of instability by going flat. When we pulled him, and it's oscillating, as you're listening to this while you're walking or you're driving, or you're laying by the pool, listening to Dr. Decompression. 5 weeks later, after the change, Randy is 90% better with his back pain, with his sciatica, with his leg weakness, with his gait. He's 90% better. That one change, because we took a flexion extension film, that one change changed everything, and it helps him prevent spinal surgery. But you have to know these things. And so when I talk to patients, I just spoke to someone in, last week, I mentioned it, in Canada, and then I spoke to someone today in Florida. And, if you can't make the trip for our intensive program that we do with patients where they fly in, we work for a few weeks, get you back on track. If you're interested in that, DM me the word relief. If you're interested in our program, DM me relief. So comment here or DM us on Instagram. Love to see how we can help you. They couldn't make the trip, so they asked for advice. And I said, ask them these 3 questions. How much weight do they typically start with? Do they require an MRI? And how do they determine if you have joint instability, and how would they address that? Those are the 3 things. That's how we make it sure. That's how I make sure that you don't get worse. So to comment on, I want to thank GoFish163 for his comment, for his or her comment. And hey, that's how we ensure at my decompression facility that we don't make you worse. If you got any questions or you want to have your question answered on the next episode, comment below. Don't forget to subscribe. Hey, I want to thank our sponsors, PillowWise USA and PowerPlate. Hey, they help me bring these episodes to you. So thank you for their support, and thank you for listening. If you're looking for help, comment below. I'm Dr. Dudum. This is the Back at It with Dr. Decompression. Thanks again for listening. We'll see you next time.